Hello, everybody, and welcome back to the second episode of the Esthetician group chat. We are your hosts, Samantha and Milena.
Today, we're going to be talking about the connection and correlation of our skin and our gut health, our lifestyle, and our diet.
So, without further ado, let's get into it. Thanks for tuning in to today's episode of the Esthetician Group Chat podcast. Be sure to follow us on all of our social media, Instagram, TikTok, and YouTube at the Esthetician Group Chat.
You've officially been added to the group chat. Now, let's get into today's episode.
First things first, I just want to preface that everything that we're going to be talking about today is backed up by science. You can literally Google it. You can ask any holistic practitioner. You can ask any naturopath. We got this information from dealing with acne for several years personally each. So we have seen multiple nutritionists, naturopaths. We've seen studies of Chinese medicine. Am I missing anything?
Yeah, I think also we just want to note that we personally have actually visited multiple holistic naturopaths in general, Chinese medicine doctors, nutritionists. We've gone to seek out help ourselves and also just have gone for lots of information in regards to the skin gut health correlation, or the correlation with our hormones and our lifestyle, and the internal correlation with our skin. Not only that, we've also done a lot of research ourselves just because we like to be knowledgeable with our clients as well, to let them know that it's not just a facial or a series of facials that's going to fix you. It's a lot of things. And
Sure.
it's not like we're not just saying this to say it. It's actually fact and it's scientifically proven.
Yeah.
And of course, there are some people that may not believe in it as much as we do, but our job, we feel, is to let everyone know that there is a direct correlation. So we want people to be aware of that.
For sure. And our main clientele range is a lot of younger clients that are dealing and struggling with inflamed cystic acne, severe acne. And 9 times out of 10, when they come to us, they say, like, I've tried Accutane, I've tried spirulactone, like, I've tried everything and it just hasn't worked for me. Like, what can I do now? And the unfortunate truth behind those medications is that they are just a band-aid solution. They're never going to completely cure your acne, because when you are on those treatments, they are just suppressing everything that is causing that breakout, and it's essentially just reducing all of the oil production in your body, because yes, acne is produced by excessive oil, but you also need oil in your body for your hair to grow, for you need healthy oil in your skin. So when people are on Accutane and these medications, their lips get severely dry, their hair isn't growing. Yeah, they get all these side effects, and that's because it's drying out and taking away from things that your body needs. And so, yes, obviously your acne is going to clear because you have no more oil production. But then once you get off of that medication, it's going to come right back. It may not come back in a week right after or full-fledged, but it'll come back in months' time, in years' time. And Milena can actually advocate for this because she's been on it. And it also causes a lot of internal issues with your gut, your liver, and all of that kind of stuff.
Yeah, so for those who may not know, I'm so open about this. I tell my clients this all the time. I was on Accutane when I was 17, 16 maybe. First of all, which is way too young. In correlation with actually being on birth control, which is crazy. So,
oh my God, you're on both?
Yeah, at the same time. They wouldn't let me take Accutane without taking birth control.
What?
Because technically with Accutane you can't get pregnant.
Yeah.
I was 16.
Yeah, who's getting
Anyways. But even so, honestly, I was at a point where, first of all, I had no knowledge of what this drug was. It was very new to me because the brand name of it is Eperis, which a lot of people think like, oh, I'm taking Eperis. It's not Accutane. That is Accutane. That's another thing. But I took it thinking that, and I was like, oh, it's just a drug for acne. Did my own research at the time, and I was like, okay, whatever, it's going to cure me. Yes, my skin was clear for 2 years, but after those 2 years, when I got off of it, first of all, I was still on birth control and my acne, it came back, but I had so many gut issues, still to this day, gut and liver issues that I'm still fixing. They're much better, but mind you, how many years was that? That's like 8, 9 years ago, and I'm still dealing with the after like effects of it on my body. It doesn't just go away. And another thing is if you're, like Sam said, if you're taking this medication, it's never going to be a cure. Like, maybe some people won't get their acne back, but down the line you could, or you could just have health issues. And another thing, when I got off the birth control too, when I got off both, my acne came back even worse than what it was when it began. So that just goes to show, like, my body was not happy with what these drugs did to me.
doing.
And I'll never be the person to tell my clients that, oh, don't take Accutane, like, don't do it. If you want to, I will never say no. I understand, but we are just here to tell you that there are other ways to fix it that are actually going to help. And will cure more.
And obviously with Accutane, you see a result in a quicker span of time. Whereas if you're just committed to changing some lifestyle things, taking supplements, doing in spa treatments, changing your routine at home, it's going to take a little bit longer to see those results, but you're going to see those results and you're going to heal whatever is causing that problem, because we both believe that acne stems from internally. Whatever's going on internally will be mirrored onto your skin and will be a reflection of that. Same thing goes with aging skin. Same thing goes with how literally just how you're going to age, because if you have the most unhealthy diet, you're going to look 40 years old when you're 16, you know? And it all plays a role, everything, even the way you're wearing sunscreen. Like, if you're not wearing sunscreen now, just wait till you turn 30 and see the result that's going to be in your face. Everything plays a role now.
Everything is connected. Like, what you do in first of all, your skin is your biggest organ. So everything shows up on your skin, whether it be eczema, psoriasis, skin irritations, acne, aging, like wrinkles, pigmentation too. There's so many direct correlations with what we do every single day in our lives. And I'm not saying you have to be some health freak or you have to like be so OCD and concerned with so many things. Like, in moderation, like the 80-20 rule is real, like 80% healthy lifestyle and then 20% like we still need to enjoy our lives, of course. But
you want to make sure you're taking the right things too. Like, you can go on TikTok and search up supplements for acne and you'll get a whole bunch of different things. But you might be taking vitamin D and your body like does not need vitamin D, and then you have an overproduction of vitamin D, and that could be triggering something or not doing anything, you know? So that's why it's always great to invest in the right
or like someone who actually knows. First of all, there's a lot of testing you have to do. Like, you can't just have a bunch of supplements that you're taking and sometimes they won't even be doing anything for you. You just think that they're good and you're taking them, but you may need things that you don't even know or realize. Like, me and Sam have both done we've done treatment with naturopaths. We've done testing where you can either do like gut testing, hormone testing, hair mineral testing, and food sensitivity. Like, it's very different depending on what you need. But at the end of the day, those tests are actually linked to what your specific body needs. Like, what I need may not be what Sam needs or the next person.
Exactly. And even so, I dealt with acne too, but not as severe to the point where I needed to go on Accutane. Mine was more so just constant stubborn breakouts. And when I saw my naturopath, she actually suggested to perform a GI map test, which is basically a stool sample test that tests everything in your body and tells you what you need to do. Or sorry, what you have. And I ended up having a bacteria called H. pylori, and this was the trigger of my stomach issues, my skin issues. And when I say skin issues, I was just having constant stubborn breakouts on my chin, cheek area, even in my forehead. So as soon as I cured the bacteria that I had in my stomach, obviously my skin isn't like 1,000% clear, but it's much better than it was before. And it's not constantly oily, constantly inflamed. And that's because I had inflammation internally. I had something going on internally, and my skin was showing me that. Even though I was having other side effects of like the bloating and the food sensitivities, my skin was a big role. And I know that I'm not someone that struggles with intense acne. If I'm having it now, there's a reason. And there was a reason.
And inflammation in your body is going to be pushed out in your skin because our body sends us so many signals, like whether it be bloating, cramping, headaches. Like, there are so many things that our body does to try to tell us something is wrong. But the main one is it comes out in your skin. Because where else is it really gonna go?
Yeah, and my body was detoxing too when I was doing that. And one side effect of the detox was my skin. I was purging and I was breaking out insane. And I was like, oh my God. Like, at first I was like, wait, this is making me worse. Like, what's happening? But then I was like, no, like, this is detoxing. And as soon as I pushed that detox, it was like the best thing I could have ever done.
The process thing. But yeah, even with medication, like Accutane does that too. Yeah. So even though, yes, okay, maybe in like 4 to 6 months your acne will be clear, you kind of have a similar timeline when you're doing these treatments. Like I know for me and Sam saw the same naturopath, but we did similar things where like I was on the 3-month detox, and in that 3 months I was going through it with my skin, but everything was coming out. And then after that, it was amazing. Like after I would say 4 or 5 months, I did not have acne. To this day, I don't really get acne unless, and if I do, I know something's wrong. Yeah. If I get a few breakouts, it's not the same as before, because it's like you're resetting your body. You know, when you're putting medication in your body, it's just actually causing more harm. Like I had to reset my gut and my liver so much because I was harming it so much. So
well, that was like me too. With the H. pylori that I have, it was literally caused by taking antibiotics and not protecting my gut lining properly. Yeah. Like I was on antibiotics if I was like sick, if I had an infection, obviously I didn't take it. But I was uneducated at the time and I didn't know much about taking a probiotic and stuff like that. Yeah. So I would just take these things and my diet wasn't the greatest. And over time, I ended up having these issues.
Yeah, that's another thing, the diet. Like, don't get me wrong, a lot of people's diet maybe doesn't affect them to the degree that it could affect other people, but that's another thing that you'll be able to understand more if you do the testing or if you get to the bottom of it. But I'll always tell my clients there are lots of inflammatory foods that trigger inflammation.
Yeah. And that's what I did too before I invested in a naturopath. I kind of like created a log and I was like, okay, I know I have a food sensitivity to something. So anytime I would eat something that I thought was a trigger, I would be more mindful of my skin. So for example, dairy is a big trigger for me. If I eat too much of it, my skin will be breaking out for like a week, but that's just the way my body is. So at the beginning, I would eat dairy and then I would go the whole week and I would say, okay, how's my skin doing? It's breaking out. Okay, dairy's a factor. And kind of just being more mindful like that also helps you too when you're going to see the naturopath or wherever it is. So you can tell them like, okay, these certain things irritate me. And it gives them a bit more of a guidance as to like, okay, what test will be best for them or what do I think they have? It's just very helpful in general.
And I think a good rule of thumb is like, obviously processed foods, fried foods, sugars, and dairy are the main things that impact acne in our skin. But it's good to keep that log, like you were saying. Just so you know, like, okay, if I need to cut out certain foods and if certain foods are triggering me, at least I know what is and what isn't. And like adding certain things in your diet that maybe you didn't do before. Like, obviously, I think this comes with like age too. And like as we got older, we changed things because you're more mindful as you get older of like changing things for your health. But incorporating like drinking more water is such a important thing that a lot of people don't understand, or like lemon water, or just eating when you wake up in the morning is important. Or like not having coffee on an empty stomach, because there's so many things that can impact us as females specifically. Not that men don't get impacted the same way, but female hormones are very different.
Very different. Another thing that is great for acne, you can call it a myth, you can call it whatever you want, but don't knock it till you try it, is herbal teas. They are so beneficial for acne. There's so many that are great. The number one for acne is definitely spearmint tea. Spearmint tea has studies that it lowers your androgen levels. And androgen is what produces oils in your body. So if you have obviously less oil, you're going to be breaking out less. And this will also help with your stress levels, just like everything. It just helps to really decrease that inflammation that you're experiencing.
What we like to base everything off of, like when you're doing treatments in spa, is we like the 80-20 rule. So 80% of it is your lifestyle, your diet, what you're doing at home. Because when you think of it, you are seeing us maybe twice a month. Sometimes once, maybe even less. People. So for 29 days of the month, you're doing everything else on your own, everything at home. You're using certain products at home. You're eating a certain way. Your stress levels could be a certain amount. Yeah, that could, like, there are so many factors, is what I'm trying to say, that play into it. And that's 80% of what impacts your skin.
Yeah.
Because your lifestyle and everything is very different than just getting one facial.
Right.
Don't get me wrong, me and Sam have both seen the impacts that facials can have, because even when clients come once, we can do a treatment and it's super beneficial for them. But will those results last if you're eating bad, drinking all the time, not paying attention to your health, your stress is really elevated? No, it's not going to.
Yeah. And another thing that plays a role into that too is what you're using at home. So if you're spending all this money coming in monthly, every other month, whatever it is for these treatments, and then you're going home and you're using horrible products, you're just reversing everything that we're trying to fix, and you're just adding to the problem. Because so there's something called a comedogenic scale. So this is a scale that rates from 0 to 5 of how likely an ingredient is to clog your pores, cause congestion, if there's irritants, if there's parabens, all that kind of stuff. So if you're using a product that has a bunch of these pore clogging ingredients in them, it is going to worsen your skin, and it's going to create a barrier in your pore, so that way nothing is actually going to be penetrating properly. So yeah, you could be using an exfoliator, that's cool, but is your exfoliator, one, clean in terms of pore clogging ingredients? Two, what beads are in your exfoliator? Because
tearing your skin
yeah,
apart.
is it creating micro tears in your skin, or is it working? You don't know. And it's nobody's fault, because average person isn't going to go to the store, see a product, the ingredients, be like, yeah, those are
That's pore clogging, not pore clogging.
So-
Another thing is companies, this is so baffling to me. Companies can say that their products are non-comedogenic
yeah,
when at least I think it's 20% of the ingredients are non-pore clogging.
yeah,
So basically you can have a product that has 12 pore clogging ingredients
yeah,
and 10 that aren't, or 20 that aren't.
yeah.
And then they can slap the label that says non-comedogenic.
Yeah. And like one thing that I notice all the time is clients will come to me and be like, oh my God, I started using this serum from The Ordinary. It's a salicylic acid serum. Okay, great. You're using salicylic acid. You have acne. Perfect. And they say, okay, so when I first started using it, it was great. It did wonders for my skin. But then after a while, as I kept using it, I didn't really notice a difference, and it actually broke me out. Well, that's because there's probably like 10% salicylic acid in that serum, and the rest is all just fillers and pore clogging ingredients.
Whatever.
Yeah, diluted stuff. So once that salicylic acid runs out in the product, you're just putting all that random stuff in your face. So what are you putting on your face? What are you spending your money on? And I know that professional products and medical grade products are definitely more of an investment than going to Sephora or going to the drugstore. But exactly, it's for a reason. Ingredients speak for themselves. You're probably thinking, well, like, how am I supposed to trust you if you just said that they could put 12 pore clogging ingredients? Well, we'll look at the ingredient list for you, and we will show you the rating of them, and we will give you the science behind that. We're not just gonna, I'll never sit there and tell someone, if they're telling me they're using a cleanser from CeraVe, I'll never just be like, oh yeah, it's bad because it's CeraVe. I will look at the products, and I will look at the ingredients, and if they're good, okay, great, keep using it. The only difference is if you're using a CeraVe cleanser and it has no pore clogging ingredients in it, doesn't necessarily mean that it's bad. It's going to break you out. It just means that it's not as effective. Like the ingredients are as
great.
Exactly. They're not as rich. They're not as potent. So you're not going to see that immense difference as opposed to using a medical grade cleanser.
And another thing to note is there's a reason why pharmaceutical medical grade products are not available over the counter. It's because they are properly scientifically formulated to be of a higher potency, of a higher percentage. So for example, if you have a product that's 2% salicylic acid from The Ordinary and 2% salicylic acid from a pharmaceutical medical grade line, the actual potency of the one in the medical grade line is way higher, and there's lots of proof on this. If you want to like research it yourself, there's so much proof, because technically, legally, the drugstore brands that you get at Sephora, Shoppers, Walmart, they legally cannot be as strong as what pharmaceutical medical grade companies can, because it's so available. Because they don't want people to be using them and getting burned, or like, they don't want lawsuits, they don't want so many things that it's just like there's so many differences. And of course it's very hard as clients to understand when you haven't done the extensive research and have learned so much about the ingredients. But when me and Sam went to school and have done trainings, we've actually learned the science behind the ingredients, and we've worked with brands that have a lot of extensive knowledge and research behind that. Which is why we suggest them. It's not just because we want you to switch your products. That's a big thing. Like if you're using something that I believe in and that I think is good, even if it's a different brand that I don't carry, and if it's a different medical grade brand, that is all I care about. It's working.
It's working.
And we don't want you to be going home and basically like reverting all the progress, because you're spending money when you're getting treatments done.
100%.
And then maybe, okay, you're spending $10 on a cleanser, but are you ruining your skin with that cleanser?
And like, our clients can literally vouch for this. Like, I had a client that came to me and she was at like her wit's end with her skin. She literally did Accutane twice, came back, did nothing. She was like, you know what, I just want to try whatever it is. So the first thing that I said to her, I said, send me a breakdown of what products you're using. Send me a whole breakdown, and it was all Sephora products. Every single one of her products had at least 8 and up pork clogging ingredients in them. The second that I switched her products, I cleared out all the Sephora products, and honestly, she wasn't ready to make the investment in medical grade products yet, which is fine. So I gave her other options from the drugstore that are clean. Yeah, they're not as rich as medical grade, but they're clean. That's what matters. I gave her 3 products from the drugstore that were clean, and that made, like, I'm not even joking, the inflammation in her skin went down so much just off of those products. Because if you are someone that has extreme acne and you're putting an irritant, a fragrance, a paraben, like, that's all going to make a difference in your skin. And with parabens can actually alter your hormone levels. If they when they get into your exactly. So when they get into your bloodstream, they can actually affect your hormones, which can cause you to break out more. So you just need to be cautious of what you're putting on your skin at all times.
And don't get me wrong, I'm never going to be the person that's like, oh, only medical grade skin. Or both like this. Like, we have other recommendations where if you're not ready to spend the money, okay, let me give you options that at least if you're spending the same amount as you are on a bad cleanser, let's switch you to a good one that's not much more, but at least will be better for you.
100%.
That's all we care about. And our skin absorbs 90% of what we put on it. So that goes into your bloodstream, that clogs up your pores, that impacts so many things. So of course you're going to be wanting to use good products. Like, I don't know anyone who hears that and they're like, oh, okay, I'll just use that, whatever.
But that's also too why we built such an amazing bond and trust with our clients, like, because they trust us. Like, that client that started off with just drugstore stuff that I recommended, as soon as she saw the difference in her skin, sure, now she buys medical grade products because she gained my trust, and that's how I want it to be. I will never be that person. We will never be that person that will sit there and be like, do not buy anything from the drugstore. Only buy what's on this shelf, and that's it. Have a good day. Like, we will never be like that, because it's scary. Like, and it's intimidating. Someone that has been dealing with acne for so long, has tried everything. Of course, they don't spend $80 on a cleanser. I wouldn't.
I know. Like, I would question it, because
but how do I know that it works?
Like, don't get me wrong, we know that it works. But obviously we've been in that position. We've been young before. Like, we're not going to tell you to spend thousands of dollars if you can't afford it too. Of course, we want what's best for you. We'll always recommend it, but there's other options.
100%.
All the time. So another very important thing that we wanted to touch on is our hormones. I know we've been talking a lot about our lifestyle, our gut and stuff like that, but a big thing too for a lot of my clients is their hormones. I have a lot of clients, and lately it's been bad just because of our food, our products, everything. Like, a lot of information is coming out on things that we use. And a lot of females, unfortunately, are getting hormonal imbalances. A lot is going on. But one big thing is PCOS, which I know so many people have, including me, including a lot of my clients. And that's another thing is first, your breakouts, where they are on your face, will actually tell you.
Yes. So your face. So if you are breaking out on your forehead, diet.
Yeah.
If you're breaking out on your chin, jawline, neck,
too.
hormones, 100%.
Yeah.
That could even be a little bit of diet too. I know
Yeah.
me, sometimes I'll get it there instead of my forehead. If you're breaking out like on your cheeks, the side of your face, that could be like your liver, your gut. Even obviously in your hairline, that could be like products that you're using in your hair.
Yeah.
But yeah, those are like the main ones.
Yeah, and personally, I know right away, like, when I'm breaking out in certain areas, what's triggering me. Yeah, I know, like, if I drink on the weekend, my forehead will break out and, like, here, because my liver's obviously impacted. So, when you are trying to figure out what's going on, that makes it a little bit easier. Of course, everyone is different, and it's not guaranteed that, oh, you get a breakout here, it's linked to this.
Yeah.
But what the New York Jane is, there's the short but also hormones is a big thing, and a lot of clients will get like hormonal acne here. And there's a very big correlation too with like the time of the month and your hormones.
Yeah.
So,
And especially girls with PCOS, like it's unfortunate because another side effect of like heavy PCOS is facial hair. So also too, obviously hair, you're producing oil in that follicle that can also cause a breakout. So it's a combination of both. And sometimes it's hard to tell the actual like factor, whether it's just the PCOS, if it's just the hair, like, so it's a little bit of a battle.
it throws a lot at you. And for example, if you put 10 people in a room and they all have PCOS, they can all look very different in their symptoms and what shows on. Like, I know people personally who don't get acne.
Yeah.
I know people who get weight gain. I know people who get extreme fatigue. I know people who get the facial hair or excessive hair growth. So it's important to know that if you are noticing a lot, especially in that area, then it's linked to your hormones, and that can be fixed.
Yeah, like 100%.
I personally have been working so hard to fix my PCOS, and it's like, it's never going to be 100% cured. Maybe one day, almost 100%. But again,
Better than what it was.
yeah. And now I'm at a point where like, I know what triggers me and I know what to look out for. So hormones are very, very impactful as females with their skin. And that's one thing that I tell all my clients too. If you want to check your hormones, don't do them with your doctor. Like, I'm not bashing doctors. That's not what I'm doing. But it's just proven that if you do blood work with your doctor, if it's extremely elevated or extremely low, yes, they'll tell you something's off. But if it's a little elevated or a little bit low or a little bit off, they won't tell you that anything is wrong. And even if your hormones are 10% elevated, 20%, you still could have a lot of symptoms that are showing through that you need to do certain things to help, whether it's like diet or supplements or whatever, getting back to that. But another thing too is obviously you don't want to have to do push on medications. Like birth control, when a lot of people have PCOS and they get thrown birth control, that's still not a cure. And when you get off of it, the PCOS will just reoccur or retrigger or whatever the hormone imbalance is. So it's good to deal with it naturally.
100%. Yeah, like even me, so mine wasn't like a hormonal imbalance. Like I said, I had the H. pylori, but just for comparison, so I did a 12-week supplement cleanse to help flush out the bacteria in my stomach, and those were strong supplements. But I also have family members who have had this bacteria, and they got antibiotics prescribed from the doctor, and it was a 1-week antibiotic cycle. So 1 week on an antibiotic or 12-week supplement, that just shows the difference of like, what the heck is in those antibiotics
for a week?
And not to mention their side effects were awful. Throwing up, diarrhea, not able to move, like they were immobile. And I'm like, how is that naturally flushing out something in your body? Like, it just makes no sense. I would rather go through 12 weeks of a detox and supplementation and all that than 1 week of that like excruciating pain that theirs didn't even get cured right away. Mine was cured after I did that 12-week thing. So it's like, at that point, you might as well do the supplements.
There's a lot of pros and cons that people don't even realize. They just want a quick fix, which understandably so. But you have to weigh out the factors of, is my body actually going to be healed after this, or am I going to have more problems from taking a medication?
Exactly.
So that's a very big thing. Even for me, I also had, not only do I have PCOS, but I had this gut imbalance, which is now fixed because I was doing the same thing, 12-month detox basically with the supplements. But in that time frame, I never felt healthier.
Yeah.
And that's a big thing. Like, if I just took maybe what my doctor told me to take, or if I just like let it be, who knows?
Yeah. And not like, just to mention, like, we are not bashing doctors. Like, I'm not bashing their practice. It's just from our experience and many clients that we've seen, and we know that we know their experience from seeing a doctor versus seeing a naturopath. When it comes to dealing with acne, we just believe that going a more natural route is beneficial rather than going to your doctor, because 90% of the time they're going to recommend you to a derm and you're going to be put on antibiotics. And I think all of our clients with acne can vouch for that because it happens all the time. So just some key advice, that naturopaths are very, very powerful and they can do wonders for you. And another thing in terms of lifestyle and things that help your skin at home, there's just so many little like tips and tricks that you can do that seem so small, but they make a big difference. So like, I know a few personally that I found is, one, having silk pillowcases. That not so much in terms of acne, that more so helps with like aging, because when you have a silk pillowcase, your skin isn't like stretching on the
though, because it's more breathable. Bacteria doesn't really harbor as much, so it's so good.
It is so good in that case. But also too, if you're trying to prevent like wrinkles, your silk pillowcases are gonna be your best friend.
Using your pillowcases, like I do the flip switch method, which some people I think is crazy, but I know it works because I'll put a pillowcase on, I'll use it one night, flip it, use that another night, and then I switch it. That for acne is good because the amount of bacteria that can harbor overnight, or if you have really inflamed cystic acne and maybe it like pops as you sleep on it, you obviously don't want to be sleeping.
And even like the detergent that you use to wash your pillowcases, even if you just use like an unscented, very gentle one, that could be better, especially if you're someone that's very, very sensitive. Also too, using hypochlorous acid, that's a game changer. It's basically just, hypochlorous acid helps to eliminate oil production in the skin and helps to kill bacteria. So after you work out, spray your face with that hypochlorous acid. Midday, during work, during school, spray your face, so that way you're just killing any bacteria that's on there. Even like, if you can, wipe your skin with like a micellar water first, so you're getting rid of all the oils on your face. Then spray it with hypochlorous acid, so that way it's a clean slate, killing any bacteria. Even high frequency wands, for those that struggle with really, really inflamed acne, those painful ones that are growing, I know they hurt. So when you feel a pimple coming, turn that thing on and just hold it on there. Honestly, sometimes I'll hold it on there for like 5 minutes. To literally just make it go down. And I'm telling you, the next morning it's gone. Or it's like not as inflamed.
It's a miracle. As it does. So for those who don't know, acne can't survive where oxygen is present. The high frequency wand oxygenates the pore a lot, but it also just kills the bacteria. It's helping and it's reducing the inflammation. We'll link one that you guys can purchase because there's so many, but honestly, it's not really that you need to get a certain one, but there's so many out there that we'll tell you guys.
And all this stuff you could literally get on Amazon too, so it's not like you have to spend great money on board sauces.
I know Sephora has it. Do not get it there. It's so expensive.
Tower 28? Not your friend.
No. And get the Element one for guys on that one.
There's even a brand called Hail Derma.
Hail Derma's really good.
It's good. A little bit more expensive, but that's just because it's more used in like spa environments and professional, but it's all the same.
It's also a really nice spray, like the mist you look for. One is a mist. It's a glass bottle too, which I know a lot of people like versus plastic.
But a little bit more elevated.
It's more like fancy. It doesn't really matter. They're all the same. So don't spend more money if you don't really necessarily need to.
And one last thing that I think is really good too is clay masks. I feel like people underestimate
the
power of it. But clay masks are amazing, especially if you have congestion or just like stubborn breakout, or you're very, very oily. Using it as a spot treatment overnight will literally just dry out your pimples, suck out all the oil in your skin.
And fun fact, clay it's not only going to absorb like the excess oil, but it calms down inflammation. It actually helps lymphatic flow. So if you put it where your lymph nodes are here and you drag it down your neck if you're using it as a mask, that can actually help your lymph flow a little bit better, which some people get acne from.
Yeah.
Lymphatic drainage, like their lymph being clogged. So that's good too. There's so many benefits. It's clay, like kaolin clay or French green clay.
Yeah.
There's a couple others, but they're very high in minerals too, which is also very beneficial.
Yeah.
And it's not like, oh, we're just throwing a clay mask on and it's just like absorbing it. It actually does other things too.
And even we both found one that we love. There's a clay mask. It's from Glymed. Is it?
Is there one?
So, yeah, I'm looking at it. So it has I was gonna say it has Glymed in it. It has sulfur in it, and sulfur is amazing for antibacterial because it's like a natural form of benzoyl peroxide.
Yeah.
So it really will just like that will really be the strong killer for the bacteria.
Yeah.
So if you're looking for something like that, you can definitely check that one out.
Yeah, that one's really good.
That one's really, really strong to them. My clients love it.
Yeah, my clients adore that one. When I use it on them too, you can just see the difference.
Yeah.
And another thing to note is I know benzoyl peroxide is obviously very popular in the aesthetics industry and in like spot treatments. Yes, it's great, but it doesn't work for everyone.
Yeah.
And I find that if it doesn't work for you, the sulfur will work. Also, benzoyl peroxide is not good to use large amounts of or like long-term use because it obviously absorbs a lot to the bloodstream and it could be a little bit toxic if it's at high levels.
Yeah, exactly.
Another little tip for acne prone clients is single-use towels.
Yes.
Amazon literally has like I don't know
boxes of it.
Yeah, I don't know if people have heard of like Clean Skin Club, but they have different ones that are cheaper, which is just the same thing with different labeling that you can get, or like single-use paper towel. Yeah, I know it's obviously not the best for the environment, but unless you're literally like washing your towel after every single use, even then bacteria can harbor in your washing machine, like or the detergent constantly on your skin. There's just so many little things like cleaning your cell phone, not putting your cell phone to your face, not touching your face. That's a big
I've noticed such a difference with using the single-use towels, especially on vacation because
the water there.
Not even that. So my last few vacations I've been forgetting to bring them. And I use the towels there because that's all I have. So like I'll reuse that towel like for the whole week or like for 2 days and I break up right away.
Yeah.
But it's because there's so much bacteria. Plus like everything is just different on vacation. Your skin is so sensitive. So I know that changing that will make a big difference because that's the only different step in my skincare routine that I do on vacation as opposed to at home. So I know that is the factor to it and it pisses me off because I do it to myself.
Yeah. But honestly, I feel like we can talk about tips for acne forever.
Yeah.
So if you want to part 2, ask us some questions. We'll definitely do a separate video on just acne because I know that a lot of people have it and that's pretty much our client base. Don't get me wrong, we do other clients, but a lot of people have acne, unfortunately, and a lot of people want to know what to do about it, male or female. So we'll definitely do another episode where we dive more into acne. This was kind of just getting into like how we correlate our nutrition, our health, our lifestyle, our gut, our liver.
And that's a wrap on today's episode. We will definitely be back with more information on this topic and hopefully with a special guest that we both had in mind and we're so excited to bring on. But thank you so much for tuning into today's episode.
All of our social media will be linked below and we'll see you guys in the next episode.
Bye.